the audience to be able to effectively hear and understand the materials. And so for the purposes of today, we are muting all participants. However, every few slides we will be pausing to see if there are questions and to open up the lines to see if there are direct questions of the presenters. As participants, you also have an ability to, if you look on your control panel, to raise your hand to indicate that you have a need, and I can attend to that privately with you, or I can articulate questions for you. You also have the ability to utilize your chat box, which is in your control panel as well, and to send messages to myself and the other presenters or to the full audience. So I want to remind you that while we will have you muted, there is that ability to constantly be in contact with us to let us know if you have questions, needs, or desires for clarification. We want to make sure that this is an effective way for you to get educated about wellness and recovery action planning, as well as developing programs around RAP in your counties and organizations. So without further ado, I'd like to go ahead and reintroduce BJ North. Some of you may have met BJ in person. Working well together, was able to utilize her expertise a couple of years ago by conducting a regional training in the northern part of California. And in that process, 18 people got trained up in order to be basic RAP facilitators. And as part of that effort, it became apparent that not only did the northern part of the state want more and more information about how to be most effective in rolling out and offering the benefits of wellness and recovery action planning to others, but we were hearing around the state that additional counties and organizations and individuals just simply wanted more information about how they might become positive change agents, so to speak, where they operate and where they live. So for that reason, we really wanted to welcome BJ back into the fold of having access and bringing you to her and vice versa. Similarly, I had the pleasure of meeting Matthew Federici last year at the International RAP convening in Philadelphia and was blown away, basically, to use an expression, by the caliber of the convening and also the level of expertise and sensitivity that Matthew brings to his position and to the needs that we have as people bringing RAP to communities. So again, thank you both for joining us, and I'm wondering, BJ, if you're ready to get started.
I am. Thank you, Donna. Before I get started, I just want to say a little bit more, just do a personal introduction, which is I love working in the state of California, and I love doing this work. It has changed my life in lots of ways. Nothing was wrong with my life before, but what it has done is enhance my awareness of how well I do take care of myself today. I have worked in many parts of this particular field, and I have used RAP not only in organizations within the government agencies, but also in private and public health companies as well. And it has really been a blessing to be able to use this work in such a well way, and to see that not only individuals are recovering, but organizations and companies are recovering using this work. With that said, I also want to say that I've always worked closely with the Copeland Center, and especially Matthew since he came aboard, in really wanting to have a well workforce in all states and around the world. So that is my mission in life, is to help do that wherever I can to support people in getting that done. And that's a little bit about what I'm doing and why I'm in doing RAP work, not only individually, but with communities. And I'll hand it over to you at this time, Matthew, to do your introduction.
All right, thank you. Well, Donna, thank you so much for that introduction. I'm really pleased to hear that feedback. That was the first international convening conference that we had, so I'm glad that it had a good impression on you. Also want to thank BJ. I mean, as I began my role with the Copeland Center, I was immediately attracted to the work and the perspective that BJ is approaching with this work, because my entree into the Wellness Recovery Action Plan was when I began to form a team in Pennsylvania to implement and develop a certified peer specialist initiative across the state. When I learned about the Wellness Recovery Action Plan, because it was the core of what we were planning to do with our CPS initiative, I realized that the Wellness Recovery Action Plan was a beautifully simple approach that really spoke to my recovery more accurately, more concisely than all of my, when I got out of the hospital and I decided to work in the field to help other people in recovery, I went through various different academic degrees, worked in many different agencies, constantly trying to seek the validation about the strong belief in recovery, what works. And when I discovered the Wellness Recovery Action Plan, I found something that just hit so home for me. But it was also really important to me in leading an initiative that we call Transformation of our system, because what RAP really provided for me was taking my wellness to another level, particularly in a leadership role, taking what I had learned and overcoming some very dark times in my life coming out of the hospital and transferring those same skills of recovering from adversity to a system-wide leadership role where lots of people were going to say it can't be done, we can't do what we're setting out to do. And so I'm really attracted and really happy that we're having this webinar, and I get to partner this webinar with BJ, that Donna is interested in the subject, which is really about creating transformational change, leadership, and RAP. So with that, thank you all for being on the call, and I'm going to let BJ talk a little bit about the objectives of today's webinar.
Change slides, please.
And I hear you, BJ, and I'm looking to advance our slides.
Okay, thank you, Donna. So for today, workshop objective, the first objective, of course, is describing the role of the Wellness Recovery Action Plan, which I'll refer to from this point forward as RAP, how it fits into an organization and its benefit to individual and system recovery transformational goals. And we have some slides that's going to touch on this, slide 10, 11, and 13, which we're going to talk about how RAP, which we're looking at wellness and recovery of our wellness, not as an illness model, but a recovery based around wellness, and how that fits into any organizational as well as the benefits to individuals. And then when individuals and the organizations get well, how that also spreads out to transforming the system, transforming communities, and transforming counties. The second objective is to have 3 steps towards developing and implementing or enhancing the RAP programs that are already at the organizations. Like, I know that since I've been aboard for the last 10 years, a lot of people have implemented RAPs in their organizations, and one thing had happened, people come and go. And the other thing that we've learned over the years is there wasn't really a great foundation as RAP came in of how to support those RAP facilitators or RAP itself in having a well workforce or a well organization. So we're going to talk about a little bit about what that, how we can enhance what we already have, what we're already doing in those agencies that already have RAP, and of course agencies that haven't yet taken on having RAP or RAP facilitators around, what would be the foundation of how to support them before you bring RAP to your organizations or agencies. And then the third thing is to identify strategies and support in supervising RAP in any form, whether it be that we're going to look at RAP as an organizational view or to support the facilitators who are actually doing groups what that's like. What are some of the strategies we need to look through for each individual agency, and also a little bit about the peer culture through RAP. And I want to help change the paradigm here in thinking about peer culture not as people who have been in the service providership system, you know, receive services, but looking at peers as anybody looking to seek wellness in their lives. That's what helped change the culture, is to know that everybody, I hope that everybody in their lives, no matter what their experience have been, is looking to have wellness in their lives. So we're going to talk a little bit about that from a different view. So those are the workshop objectives for today. And I'm going to hand it off to Matthew. You can change the slide, Donna.
Okay, great. Thank you for that, BJ. I'm going to build right off of what you just said. And these next couple slides, really talking about a wellness perspective and what that means. It's important when we talk about how we're going to develop RAP programs, Wellness Recovery Action Plan programs, and introduce RAP into our organizations, that we really understand the history, the foundation and the guiding principles of how the Wellness Recovery Action Plan evolved, its impact on the system of support for people in recovery, and just how that interplays. So next slide. So as BJ said, it really evolved from a really clear focus on wellness. The Copeland Center for Wellness Recovery, kind of a little unknown fact, that was actually named in honor and dedicated to Catherine Strauss Copeland, not Mary Ellen Copeland. This is Mary Ellen Copeland's mother. You see a picture of Mary Ellen Copeland's mother here. And at most facilitators, hopefully all facilitators, know this Kate's story. It's an integral part to the context of the Wellness Recovery Action Plan. Mary Ellen's mother was hospitalized in, at the time, what would be called an insane asylum. And when Mary Ellen was about 8 years of age or so, visiting her mother, who she was told was incurably insane. It was an environment of which Mary Ellen describes as horrific. This is the foundation for what later came as Mary Ellen grew up older and was able to see her mother come out of that environment, and despite being told the message of a dire prediction about her mother's future, her mother went on to become a very well-known nutritionist in her community. She began to gather with other patients when she was in the hospital. Kind of ironically, as Mary Ellen's mother tapped into peer support in the hospital, she was immediately discharged. And from there, she moved beyond that label of being incurably insane. This is impactful because as Mary Ellen approached her own challenges with mental health challenges in her life, she went to seek help, and as she sought help, she was, coming from a perspective that her mother moved beyond those challenges. So she sought out information about recovery. How do I get well? Not how do I kind of manage or get away from my illness, but how do I get beyond this and live well again? And short end of the story for this webinar was that she didn't find any information. So what she did was she decided she would reach out to other people like herself, like her mother, who were also struggling with these challenges, and start asking the question, what is working, what doesn't work, and what works? And this is the place in which her research began, and she developed what we have today, the Wellness Recovery Action Plan. This paradigm, this perspective, is foundational to what makes RAP RAP, and is very important to the center to maintain that nature. Next slide, please.
We sometimes have a lag in which it's in the slides, so my apology.
That's okay. So when Mary Ellen began to ask these questions about what works and doesn't work, she started off by asking people through way of journal entries, pretty much. People sent in, hundreds of people wrote in stories about what was working in their recovery. And this was the first part of what she had called the 4 parts to the study on mental health recovery. And from that, she was able to what we would call qualitatively capture 5 key concepts that BJ will be talking about. She saw that people who were doing well had hope about their situation, that they took personal responsibility. They focused on what they could do to change it, that they sought out information as much as possible that would help them, education, that they advocated for themselves, that they asked for what they needed, they went for their goals and dreams, and that they used support, predominantly natural supports, friends, families, at least 5 key supporters. From there, Mary Ellen began to do workshops with her peers like Jane Winterling and Alan McNabb and others, and they developed the next part, which was the Wellness Toolbox. And the Wellness Toolbox were really a collection of very simple things that were accessible in people's lives, whereby people could go to these things when times were getting tough and use these tools to get through tough times. And this was the second part of the study, the Wellness Toolbox. The third part was after a person by the name of Jess stood up in one of the early peer workshops that were being run, who said, you know, these concepts are great. I like the idea of these tools, but my life feels so chaotic. I don't know really how to put all this together and get out of my situation. And from there, Mary Ellen and a group of peers sat back and said, what are we doing? How do we, I like to say, operationalize these concepts and tools in our lives for effective results? Here, Jane Winterling most significantly contributed to what's most popular known as RAP today, the structured plan, daily maintenance plan, identifying our triggers, and so on and so forth. BJ will touch a little bit more on that. And then the fourth topic was the fourth part of the study, what were called recovery topics. These were popular themes, wellness tools, and topics like building self-esteem, peer support, trauma recovery, work-related issues. These topics evolved out of the workshops that were being developed. And this was an ongoing process. As you can see here, each part of these studies, Mary Ellen began by saying, my peers, people like me in a similar situation who want better wellness for themselves, will have answers. Together, we can. And that process continues today. Next slide. So from here, I'll let BJ tell you a little bit more about the key concepts, and in particular, how these key concepts really kind of stem into many areas of our life.
Thank you, Matthew. So the 5 key recovery concepts, we used to call this a long time ago when Mary Ellen first this has actually changed. What they used to be called was the 5 foundations of recovery. And since then they have become the 5 key recovery concepts. And really, it's really important in my life and a lot of people's lives that when we're going through these workshops and overviews, that we talk to people about it. And sometimes, you know, it's the first time that people have been asked, you know, what does hope mean for you? And on an individual level, being able to describe and define that for ourselves has been amazing. And looking at the organizational standpoint of hope, what is the organization hoping to get out of, you know, going through bringing RAP as a tool that they're using in the transformation of becoming well as an organization. So hope is this thing like, what is the spark in us as individuals and us as a company or a group or a community that keeps us going? Personal responsibility, meaning that it's up to me, the choices and decisions I make in my life, and what comes in or out of those choices and decisions. And looking at it from the agency's perspective is, what is the responsibility with the agency, with the people they are working with, who works for them, or in the service providership that they provide? What is the responsibility? and really having a clear idea of what that is when we go into building a well organization, really having an idea of what is my responsibility versus what is the individual's personal responsibility. Education probably being the biggest part of that is for individual having education, not formally, but looking at what do I need to know about myself. I remember when Mary Ellen asked me that question about what do I need to know about myself, I really realized I hadn't been thinking about myself. I had been working in the system for many years, and that's not a question that I had to answer, because my answer was to think about how I was going to help those people who were coming in for services from me. So when I had to look at education for myself, that was an awakening thing for me, and I realized at that moment that I wasn't as well as I wanted to be. I think that comes up for a lot of people who actually answer that question for themselves and educate themselves about what they're doing in their life.
Muted.
Ethics that we hold as we're out doing this work as individuals, and what that looks like from an organizational standpoint as well. The biggest one, I think, is the self-advocacy, is learning to what does it mean to advocate, not to beat people up, not to make people see things our way, but to really advocate in the needs and wants that we need individually, but also looking at that as an organization. What are some of the things we need to advocate around? And I think
here's the big building, and she lives 2 blocks over.
So I get to sleep in.
Hello? Okay. Donna, can you still hear me?
Yes, I can.
Okay. I just heard something come on my earphone, so.
Yeah, there was an unmuting of a few people, so my apologies about that.
No worries. So self-advocacy, really learning how to define that for ourselves and for myself was really knowing that, instead of, like I always share this when I'm doing the WRAP 5-day, is that I used to advocate with my fist or with my voice or with my energy, telling people what I wanted them to do, instead of coming from this expertise, this education I learned about myself, the things that I needed in my life. And learning that has changed my life, because I don't have to be stuck in shame, blame, and guilt. I don't have to make somebody feel wrong. I know that what I'm doing in my life is about me, and what I'm advocating for, there are ways to gather support around that so I can advocate effectively, but I have to educate myself on that to know what that is, and then take personal responsibility to do it. Looking at self-advocacy or advocacy even from an organizational standpoint, when we're having WRAP as part of the organization, as part of the wellness that's going to happen, is like, what do we need to advocate for? Because, working in the field, what I've learned is that there are these rules that happen within the organization, and then there is the individual who wants to advocate, who has learned how to, these 5 key concepts by themselves, and then when they're trying to marry this with the organization also has rules that they need to follow, things they need to go by. And so it's learning how do we support one another and hear what we're saying, the people who are working for us, and what the person needs who needs support to get the groups done. So we'll talk about that a little bit in detail a little later. And then support, of course, being the biggest piece. And Matthew was talking about the 5 key supporters in our lives. And support, I think, is a huge thing. And how do I take personal responsibility, educate myself on what the support is that I need, and advocate for that support, whatever it may be, and get people to really hear what I'm saying and not have a comeback to say, no, you don't need this, you need that. And so this is where we learn to, listen to the individual's perspective from the organizational view, listen to that perspective and seeing if we can support them in that, and becoming a mutual team. with the learning of what this individual just learned for themselves and also what the agency needs. So these key concepts have been beneficial not only in the personal lives of many people, but then in the organizational view as well. Next slide. So the next thing is WRAP itself. And before we do WRAP, we always do this thing called the Wellness Toolbox, which are simple, safe, and inexpensive things that we use. And it's biggest part, what I call the kind of the blood of the plan, because we use these wellness tools in many sections of the plan as an action plan to things that come up for us. And the Wellness Toolbox is things that we identify, whether it's individually or agency-wide, of what we're going to need in order to keep our wellness. And so we make a list of those tools and what we're going to need them for. You know, some of the tools that I use for myself is making sure that I walk every day because I know it's good for my body and I know it's the best exercise that I could do for myself to walk 30 minutes a day. For an organization, a wellness tool may be that we have a meeting once a week just so everybody's on the same page of what's happening. That may be, the meeting may be a wellness tool. The next part is daily maintenance plan, and daily maintenance plan is a list of 3 lists: what I'm like when I'm well, daily to do, and some choices or option things I may choose to do. And what we do is that first list, what I look like when I'm well, we go through and we make a list of what we think we look like when we're well, or what we might want to look like if we don't know what we look like, what we might want to look like when we're well. We make this list, like myself, I know that I love to talk, I know that I love to connect to people, I'm extroverted, so I'll have some kind of information to go by if those things aren't showing up. As an agency, whether the agency looks like when it's well could be something like they're always communicating, people are happy, things are getting done, the lists are getting checked off, you know, people are coming into the agency, you know, and there's an open door policy, you know, no complaining is happening like that. The daily to-do is things I need to do on a daily basis to keep myself well, and some of those things are, for me, I know that I just need to check in with myself every day to make sure that I'm feeling good. I have a list that I go through every day. I make a list in the morning when I wake up. I make sure that I make that list so I can have some general idea of structure of what I'm doing for my day, things I need to get planned, things like that. A daily maintenance list for an organization could be that on a daily basis, you know, people are showing up. Everybody knows what they're doing with their job. You know, whatever may be, you know, there are lights on in the building, you know, it's like, so we can show up at those jobs and do things. So really like these simple things that we need to have in order to do our job. And then choices and options is maybe once a week. I might decide to go to a movie because that's really beneficial for my wellness at the time. And maybe job-wise, what happens for, you know, conscious educators, some of those choices meaning that I'm just going to give people a day out just to take the day off because, you know, we've been doing some great work. The next thing we look at is triggers and a triggers action plan. And triggers are external events or circumstances that, you know, I react to. And so trigger for me would be, you know, that something's happening in the community. One of the things that I always say is that I go to the grocery store and someone gets in the space behind me and they're really close in the space behind me. And so I get triggered by that need to have more distance. One of the triggers in a community could be that someone is upset about something that happened that was working with me and they go out and talk to someone else rather than coming back and talking to me. So it could be a triggering effect because word of mouth is everything for my business. An action plan to that trigger could be, for me, it's when I go in the store, I always use a shopping cart to judge my distance and space, you know, around me. And an action plan in my business when that happens is that that person finds one of their supporters and talks to the supporter about it and eventually comes back and talks to me or the admin or whoever's working that day. Early warning signs would be subtle signs of change that happen that, you know, only I knew about as an individual. And what those subtle signs of change could be is that, you know, I'm an extroverted person. That's one of the things I do. I love to talk in the community, but I'm starting to isolate. I'm not opening my front door. I'm not answering the phone. And an action plan for that is to pick up the phone. I get from my wellness toolbox. I pick up the phone and I call a supporter and tell the supporter what's going on, you know, so I could hear myself talk about it and maybe come out of it. An early warning sign for an agency may be that that news that got out is now spreading, and other people who heard that story are now telling other people what they heard. So you have these fires coming up, or they're not liking somebody they're working with. When things are breaking down, or it's the last possible time before an individual's in a crisis that they have to get back to wellness. And when things are breaking down, everybody can see it. It's a difference than being subtle. It's now that my family knows that I'm not doing well, and they can see it. And so for me, that may be I am looking in front of the TV. I'm staying up late at night, and I'm into the infomercial buying things, and my neighbors see the UPS truck, the mail truck, you know, pulling up, dropping off stuff. So I'm just doing this online shopping. And action plan for me is that my dad, I have a couple of neighbors who call my dad and say, hey, I haven't seen BJ around, but I see all these things coming to her house. And my dad, he has his role in what he does for me. He becomes my support at that time. When an agency is breaking down, it may look different. It may be looking like there are cliques that have formed. People are talking about one another. There's not a lot of work being done. There's people having stories about the bosses. There's, you know, all this chatter is going around, and the most work that's being done is that chatter, the gossip, you know, things like that. It may look like these people who usually are talking together are now, you can go by their cubicles or by their office, and they're just in their offices by themselves and not talking to other people in the agency. And one of the action plans, of course, is to try to get back to doing everything that they came up with, what the agency looks like when it's well on a daily basis. Crisis planning is a plan. This is the plan that has 9 parts, and we individually, we build this plan, tell people, our supporters, what treatment we like, medication, all these things, and we give it to those people we want involved in our lives when we're not doing well. So, and I think this is a place where there's a lot of judgment that comes in about this is only for people who are actually in mental health. And I always say that, you know, I could have a broken leg and not be able to do what I need to do for myself, and that could be a crisis for some people. You know, bringing my son home from the hospital was a crisis because I hadn't really thought through what I needed to do for him, you know, that it was going to consume a lot. And I wish this plan would have been available. So, and then there's people, of course, who do it for their mental health reasons. Well, the crisis plan is something that I share with those 5 people Matthew talked about earlier, who I've identified as supporters. And I ask them to help advocate for me during this time, whether they're, you know, doing shopping, taking my kids to school, doing some cooking, whatever it may be. I've come up with this plan that may be beneficial for me when I'm not well. If I always say, if the organization's in crisis, it's probably not an organization happening. So we don't do a crisis plan, you know, necessarily around an organization. I hope that none of the helping professions are ever in that much of a crisis. And I know the financial market right now may be that we are building crisis plans for some of the organizations. And then there's post-crisis planning, and this is the only time when we're not doing as well that we build this plan to look back at what happened during the crisis. Did my crisis plan work? Did my supporters show up? Do I need to make amends to people? It's just a lot of inquiry questions. That's the first part of it. About how did my crisis plan work? You know, what do I need to do now? Do I need to go home? You know, one of the things that I have is I have the ability to go to a hotel. I have a little fund that I can go to the hotel and maybe not come back to the house for the first week out of that crisis or something, just to gather myself. And so really thinking about how well did that work, what I need to change when I do that again. And then the second part is resuming a timetable for resuming responsibilities, and that timetable would look like maybe I'll go back to work for 3 days the first week. Maybe I'll still have someone take my son for the week, and gradually take my responsibility back, because sometimes taking it all back I might end up back in that crisis, which I don't want to be. So that's a little bit about mental health recovery, which are the 5 key recovery concepts: whole personal responsibility, education, self-advocacy, and support, and then, of course, WRAP, the Wellness Toolbox, and WRAP. So with that, I'm going to hand this off to Matthew.
And this is Donna Matthews with Working Well Together, and I'm thinking that, do we want to pause for a moment and see if there are any questions?
Sure. Are there any questions, comments?
Okay. I've unmuted one individual who had their hand raised. So if Richard's on the phone, if you would like to ask a question, feel free.
Well, my question was, as I mentioned, I made on the message board, the 877-800 number is not working. I'm calling from Southern California. So I hope you can hear me with this tiny little speaker. And
I can hear you fine, Richard. Thank you so much. And I'll work with your 877 number.
Okay. And on the crisis plan, can you be a little bit, elaborate on that a little bit more?
Sure. And Richard, can you be specific in the question? Elaborate, just telling you the different parts of it?
No, just the crisis part of the WRAP includes the tools. The part of the crisis plan from the WRAP includes.
Right.
What are other suggestions you might have?
Well,
for writing a crisis plan?
That and, yeah.
I think what's important when you think about the crisis plan, one of the things that I used to really be an advocate for was something called a psychiatric advance directive. And if you're familiar with that,
yes, I am.
There's a component to the crisis plan. Before psychiatric advance directives, a lot of the parts within the crisis plan, a lot of the questions you might engage a person to ask are very similar to the advance directive. However, what I like about crisis planning in WRAP is that it takes a broader scope. And, for me, it's largely about that place and time in my life, and even organizationally, where I need to hand over responsibilities. I need people to step in. I define who those people are to step in my life. So for me, it was very eye-opening to really look at, I went through a crisis where I had a lot of professional psychiatric supports come into my life. But now, at this place and going through that experience, I have a plan where I can have family members and friends create a respite for me. I also can look at times when I've worked at organizations where we needed to have people like business consultants step in. We needed the board to step in and take responsibilities away and really kind of create a safe environment until a lot of the distress that was going on settled down and responsibilities could be handed back over. So this is really a customizable area for each individual or team or organization where you can get a lot of ideas like what hospitals you want to go to, what types of treatments work for you, what medications may or may not work for you, but you can also talk about what are the specific types of supporters that you need, what are the specific type of environments that you need to be in. So it's like a broader perspective, and it really just comes down to this is a time in your life where you need more support. You need people to step in and take over responsibilities for you. BJ, did you want to add or reflect on any more of that?
Well, let's see if the caller, if that answered his question.
Thank you.
Okay, and we had one other question from Marjorie. Would that be okay if I opened up the line and she asked?
Sure.
Great. Okay, Marjorie, you're unmuted now. And anyone else who would like to ask a question, all you need to do is raise your hand and then we'll call on you and unmute you so you can talk. Go ahead, Marjorie. Okay, and I'm going to go ahead and voice an issue that Marjorie had mentioned to me on chat that she wanted to ask about, and I'm going to represent it as an issue that from my perspective as well, rather than talk for Marjorie. And that is the application of using RAP, not just with, clients, so to speak, right? So some of us are in county systems where we use terms like clients, but rather that BJ and Matthew, if you can just speak to the fact that RAP is something that all individuals and families can actually use. That would be a correct perception, wouldn't it?
Yes.
Okay. So I think I'm just wanting to kind of reiterate that sometimes those questions come up for us or for me in talking with people about my perspective and the way that I represent in WWT, Working Well Together represents RAP. We hope is in line with the values and ethics of the Copeland Center, which is that this is a wellness tool that is really applicable to anybody and anything in order to become more empowered in our own wellness. Okay, I'm going to just scan and see if there are any other questions from our members. And I'm seeing that Karen has a question. Karen, did you want to go ahead and ask a question? Okay. And Kristen Dempsey. Okay, Kristen Dempsey, do you have a question? And Kelly Jack, do you have a question? Okay, then why don't we just continue with the presentation for right now.
Thank you, Donna. And Matthew, it's on you.
All right, so first of all, BJ, thank you for sharing so much of yourself in such a very concise way. I think you really reflected well how RAP is, the different parts of RAP that you went through, how it is it's universally applicable to many aspects of our lives, and I think you model it well, and you have great examples that came from your own experience, and it talked about at a level of running a business to a level of your own recovery. You talked about your family, and so this really is a key to what I want to talk about next, and that is that one of the beautiful things about the Wellness Recovery Action Plan and how it's been facilitated over the years is the perspective that it comes from, the way that it is really looking at things quite differently than what I had really been introduced to a lot of in my academic and in my professional career, working at agencies. And so this is why I kind of chose this slide here when I talk about RAP at this level of counties and agencies and organizations. And the quote here is an Albert Einstein quote: "The significant problems we face cannot be solved at the same level of thinking we were at when we created them." And why I like this is that when I look at how this work came to be, and I look at it in a historical context, and I look at what Mary Ellen in time and space and how this kind of evolved, is very much to me like, Albert Einstein in his time really looked at the way the physical world was quite differently than what we had, for the most part of our history, looked at the physical world around us. He took a relational perspective that really just looked at things very differently versus the common way of thinking in terms of physicists at the time was looking at everything in terms of a mechanical world, parts, little cogs and wheels. And he kind of blew that out by looking at it very differently. Mary Ellen, on the same regards, 15 years ago, really kind of came at this whole situation very differently. And that was to look at it from an inside-out perspective in terms of looking to one another, looking towards our inner experiences, sharing those inner experiences collectively, versus the way it commonly was being done, which was observing people, listening to what they were saying, observing, theorizing about what was going on. This whole idea, which is very common today, but 15 years ago, was a completely different way. I know, that part of the training is in psychiatry and psychology is to really look at the idea of an expert interpreting what experiences mean for other people. And Mary Ellen approached this from a perspective of the people who were dealing with the adversity had the expertise, that the expertise came from within, rather than, looking at it as people are so distressed, people who are detached can make objective observations about what was going on and help them out. Very fundamentally different. Next slide, please. And so when we talk about the Wellness Recovery Action Plan and we look at it, how we want to introduce this into our organizations, it's important to really understand that it's a very different way of looking at the question of wellness. And in particular, really first understanding as you look to utilize the Wellness Recovery Action Plan as a program, to look at it as a living, breathing process. It's organic. It is a process that involves the experiential knowledge of everybody, so that it is really not about a kind of a part to a system. So it's not about the service recipients, or as Donna was saying, the clients, and within the machine of the behavioral health system. It's not a part, which commonly happens, is to look at RAP as a part in of itself, a document that we can put into our charts. We can insert it into this part of the systems process. But really looking at it holistically, looking at it as a framework that can be transferable to many different aspects of disability, culture, could be team RAPs, organizational RAP, businesses, individual. I think learning objective on this webinar, number one, was thinking about RAP, its benefits on an organizational and individual level. And BJ really hit that home with her presentation on the different parts of RAP by talking about it on an organizational and individual level at the same time. And that is because her approach and understanding of this is coming from this living, breathing process, that RAP concepts and the structure of planning and attacking challenges in her life is an ongoing process, that as her life is dynamic and changes in relationship, so does the RAP plan. And this is a very different way. As I've worked in different organizations and we started talking about RAP, particularly in the 3-day course on implementing and supervising RAP, that I've noticed that this is the most important thing to do right off the bat, is to understand that we're approaching this from a different perspective, that this is not a solution to a problem that goes into this part of your programming, but really can be approached from a holistic perspective. Next slide.
And Matthew, I just want to insert that we're getting several questions regarding this difference between the process and systems trying to adopt this kind of a process into the systems. So
Sure.
do you want to wait until a little bit later, or do you want to address those questions now?
Let's talk about it now.
Okay. So we have one comment from an individual who says that they love the idea of doing organizational RAP and are wondering if there are any examples of this from like public systems of care, and wondering how are staff engaged and who takes the lead in rolling it out so that they're adhering to these kind of process values that you're talking about and not trying to make the fit into a system. You know what I mean? Not losing the valuable pieces of process.
Well, the quickest answer is yes. That we have done organizational RAPs for particularly behavioral health agencies in particular. I know that prior to coming to the Copeland Center, we had a team of RAP facilitators, advanced level facilitators at the agency, but we also did team RAP. We also looked at RAP at the organizational level. Even though we had several advanced level trainers, people who have developed RAP, used it a lot in their own life, it was very beneficial to have a partner advanced level facilitator who was outside of the organization come in and take us through that process so that everyone, including myself, for example, could be a part of the conversation, not necessarily focus on facilitating it. So to me, that was a key benefit versus, say, me trying to do my own team wrap with my team members so that I could really fully participate in it. And so, yes, this has been done on many levels. And to me, it is really key to, if you are an organization that wants to be implementing wrap into its system, that we look at doing it at all levels. And we're going to talk a little bit later on about, kind of the steps. And I guess I'll hit them right now. I mean, the basic 3 steps is to really go through the process of developing a wrap for yourself, use it as regularly as possible, take the facilitators course so that you can offer wrap groups with others, take the advanced level course after you've been running groups for a period of time. So when we have organizations where as many members as possible are going through all of that process, and as well as not only bringing wrap to the people within the organization, but thinking about it on the organizational level as well. Did that answer the question?
The person is not connected via audio, so I think we can move on to the next one, and I'll continue to scan for additional questions regarding that topic. I think that there's also a question just about how you get that level of buy-in from all levels within a system, and I'm wondering if that's anything that you can speak to at the moment. So in other words, if I'm out there and I'm working in a county and my supervisor supports me doing wrap groups, how do we as individual employees help our organization understand the value of taking it to all levels of our system, so that it's not just seen as a service necessarily for clients, if you will, and I'm using quotes around that as I say it, but that we're really we're allowing ourselves to benefit as an organization from these concepts and strategies. You have any suggestions for how we kind of pull everybody in and get that buy-in at all levels of our organizations?
Well, I'm gonna make a brief comment and then make sure that BJ has an opportunity to reflect as well. Yes, it can be very challenging, particularly if wrap is not being seen and we're not really looking at. I'm going to share two key unique aspects to the Wellness Recovery Action Plan in the Copeland Center around 2 popular topics. One is recovery. The other one is peer support. One, in the Wellness Recovery Action Plan, we're really focusing on recovering our wellness. BJ said this earlier, and that is that we all have a stake in recovering our wellness. We all can identify with periods of time where our wellness felt at jeopardy on many different levels. And this is really about what works in terms of what we have found works for us to regain that wellness. This is very different than when recovery is talked about in the recovery movement right now. It largely has to do with recovering your life from a mental illness. But in wrap, we're really talking about a different way of looking at things, which is recovering our wellness, which is a common denominator for all people. 2, when we talk about peer support, we're talking about a way in which we relate to each other as both being equal companions in that pursuit of wellness, that we both have a stake in trying to recover our wellness. We both have ideas that have worked for us. We could benefit from each other, and that the peer support is how we're relating to each other. This stems from our core values and ethics, which we'll talk a little bit about later. That perspective has to be what is introduced before people can start to see its universal application at this level.
And BJ, did you want to add anything?
I actually do, and I think that for tying into the last question in this one is, when some years ago the Copeland Center decided to take this bigger view, and what they did was to getting people to buy in was an invitation for an organization to become well. And the first system that actually bought in that was Monroe, Dade, and Monroe and Dade counties, Miami, Monroe and Dade counties in Florida. And what they did was, first of all, the mental health director had heard about this, and they called the Copeland Center out, and they first were just sending people through who had been receiving services from them. And what happened to that first core group was that core group then needed support from the county in a different way. And Deborah realized that something was happening in these individuals that were advocating, that they were doing it in a different day. So Deborah took it upon herself to have us come out again. So in this 3-year process, what they did was eventually they had all of their staff go through the 3- and 5-day, even the health director, who was not only mental health but physical health and, you know, overall the health in that county, decided to go through herself. That was Sylvia. And what she found out in it was that she wanted to help change the system, and so she made an invitation to those who not only worked or line staff or provided services, but also sitting in the room with those who they were providing services to, having a paradigm shift in the moment that we're all human. How can we help each other out? And what they found out was the job wasn't as hard when the person was driving their own wellness, when they didn't have to drive the person's wellness and their own as providers, but that they became partner with the people they were serving. Then they got the jails involved, and the jails weren't necessarily in mental health. These were people who were going to jail for whatever reason they were. And so Cindy Schwartz also came along and decided to train all of her staff in this. And so that county, those counties got an award for the way they were changing the system using the wellness tool of RAP. And so the whole system bought into that, because now the people who were receiving services, or those people who were using those services, were not being told this is what you need to do, this is what you have to do, and giving things that they really didn't need at the time. What they were doing was driving their own wellness, and people who were providing the service were supporting them through it. So they learned how to articulate what it is they needed and how to get their goals and supports met if they needed anything within that system. So some of the people were actually coming in the front door and actually exiting the system, which, as we know, it becomes a revolving door. So that's just one example, and I have many more. But that was a huge example for not only the Copeland Center, but for me as an individual who then opened up Conscious Educators.
Great. Thanks so much, Matthew and BJ. There is another question, but I want to ask if you guys can just bear it in mind as we continue with the presentation, because I want to make sure, be mindful of our time frame. And that's regarding how to start implementing kind of like an organizational RAP program. So how to build that support for people who are facilitating groups and that sort of thing. I know that there's some of this information addressed a little bit later in your presentation. So would you both like to move on now?
Yes.
Okay, so next slide.
Is this the slide that you're looking for, Matthew?
Yes, that's great.
Great.
That's great. So, you know, really kind of in line with the questions that are coming out. You know, so the recommendations to building RAP with integrity and sustainability. This is our challenge as a center that has, you know, over 200 advanced level facilitators like BJ around the world, thousands of RAP facilitators. Is, you know, how do we stick to the integrity, and how do we develop sustainable systems? You know, one of the challenges that in getting systems to, as what was said earlier in that question, buy in to thinking about RAP in this level is really preserving that the Wellness Recovery Action Plan is facilitated in a way that invites this perspective. It invites people to see its applications at this level. So, you know, right off the bat, if we're presenting the Wellness Recovery Action Plan to a kind of closed labeled population versus offering the Wellness Recovery Action Plan to people, this can really set the stage off in a way where people are looking at RAP differently and maybe not seeing its applicability. When it's facilitated really well, you have people, for example, when we're once being asked to present RAP, which is called Seminar 1, which is developing RAP course. This is the basic course that was offered in the evidence-based study by facilitators, whereby people are walked through the opportunity to understand and start to develop their own wellness recovery action plan. Remember, in Philadelphia, being asked to provide RAP education to a group of case managers that were in the system. And so right off the bat, we encourage them to really invite everybody in the system to the workshop, not just the case managers. And in that process, I know we did a good job when at the end, people who came there and said, I'm here to learn about this RAP thing for my clients, left there and said, you know, this is a really valuable tool for me. That's when I know we got off on the right foot. And we were facilitating the Wellness Recovery Action Plan according to the values and ethics that we were trained to do it in. So we are very happy at the Copeland Center that a very rigorous study was done that basically demonstrated significant evidence that the Wellness Recovery Action Plan creates really positive results for people in their lives. And the model in which that evidence was conducted was through 3 basic courses. Seminar 1, which again is this basic course for people to learn about RAP for themselves. Seminar 2 is the RAP Facilitators course. This is the course that is centered on values and ethics for people who can then go out and present RAP to various different groups, as I just illustrated. And then once the individuals have used a RAP in their life for a period of time, have completed the 5-day facilitators course so that they can then facilitate that for others, and they've done several groups for a period of time, and now they have experience with RAP groups, they can apply and take the advanced level course where they learn to provide the facilitation course to others. This is the sustainability level. Point in fact, this is how, you know, BJ, for example, has worked in various different communities over time in developing more facilitators and allowing this to evolve and grow as it started some 15 years ago with Mary Ellen. Next slide. Okay. And I think, BJ, were you going to talk a little bit about this?
Sure. So what do we look like when we are well? This is the part 1 of daily maintenance plan. And just to support and promote the growth of employees' performance as a leader, we need to know what good performance look like. So really making a list, and first I think we have to identify that as individuals of what I look like when I'm well. Because if I don't know what I'm looking like when I'm well, how could I ever be a part of some, you know, when someone else is not well? Because what I find out in identifying it for myself is that no one else could have identified that for me. So on an individual's level, it's really important that I get to identify and share that with others. When we look at what good performance looks like, and doing that for ourselves, the other thing it keeps us out of is judgment of someone else when they say, yeah, I'm doing really well. And we look at that person, and from our definition of wellness, that doesn't fit it. So what we learn when we do that is that we couldn't define it. If that person feels like they're well, I want to support them in what they've defined. You know, I want to enhance that for them. The same thing goes as when we're looking at, like I was talking earlier about the job, and what do we know good performance look like? What would that look like to have good performance? And it's about getting the buy-in in the moment when we do an organizational RAP from everyone, not just from, you know, upper management or middle management, but what does it look like when everything is going well, and have everybody at the table, because I think the perspectives around the table are going to be different. And that's when the organization can see that, yeah, we have this list of what we think it may look like, but what came out of that discussion or that group wasn't what was in, you know, our values and mission statement of what this was about. So it's really to be willing to change or to have mutual respect for what's coming up around what good performance looks like. I think that's always a judgment call, especially when people think they're doing good, but I can say, well, I don't think you're doing good to my standards. So how do we just agree on that, as an organization? And again, I think I have to go back to, first I have to identify what it looks like for me, what I look like when I'm well, so I can answer this, help answer this in the group as well. And to have clear indicators to know what happens when we do our work well. And what are the indicators? What are the clear indicators that I'm doing my work to the best of my abilities, right? And I have to know that because I have to know that I may not be able to do what Bob's doing, but I know for myself, because I have a limitation around something, but I know that limitation. And then when my boss, I signed up for the job, and my boss said, well, but you're supposed to be doing this, and but I haven't been praised for what I have been doing that I was doing well on. So it's being able to have to have that support, that mutual support, that advocating, that education of knowing that I need to tell my boss, it's up to me in that moment to say, I don't have that skill. I'm wondering if we can give that out to someone else, or somehow to be able to. How do we define what good performance is and then praise it? Well, I think it has to come from the individuals who's doing the good performance, but how do we negotiate that in the organization? And so, and what we always say, we support people, we don't pull up their deficits, because in the world there's many deficits that we already see ourselves, and if we keep identifying the deficit of the employee or the person who's thinking they're doing a good job, then that's what they dwell on. But if we help them dwell on the things that they feel they're doing good or doing, to the best of their ability, then they keep growing from that. And what happens is that deficit ends up going away because they keep doing what they've been praised to do. And I love that in my life as well as an individual. When I've made this list, or just what I look like when I'm well, people comment about that. And in my family, in my friends, in my community. And so I think that's, when we take it organizationally, that's how we want to give people the invitation to also invite them into the process of learning to tell us what they want us to see about them, so we can see that instead of having our own judgments and criticism. And I think that this is what part of this slide is about for me.
Thank you, BJ, and this is Donna. I just want to jump in and say I so appreciate what it is you just said, because I think that this is what, as I'm interfacing with people who have gone through basic rep facilitator training, there's sometimes a question as to how to be most effective in doing the good work and receiving the support that you feel like you need to continue the good work on your job. So what I'm hearing you say is that as basic rep facilitators, for us to use different vehicles like our supervision or what have you, to articulate what's going well for us and what kind of support we might need to continue that good work. And then conversely, from the point of a supervisor who may not even be aware of the depth of work that we do in offering rep and maintaining our own wellness and utilizing that, to simply be offering that support in the way that you and Matthew have referred to it so far, which is not to go into it trying to solve a problem for someone, but rather to ask them, how can I continue to support you in bringing this service or bringing this wellness perspective to our workplace?
Yes.
Great, thanks so much.
Mm-hmm.
Ready for the next slide?
Next slide. Matthew, it's on you.
Okay.
Matthew? Did we lose Matthew?
Check and see how he's doing. Look, oops, Matthew Federici somehow got muted, so he is now unmuted. Matthew, are you able to join us with this slide?
Thank you. I got pushed out into cyberspace there for a minute.
There you go. We got you back.
Okay. Well, I might repeat something because I lost sound and then I was muted. But so one of the things we want to talk about here, and again, in the a 3-day course that we provide around, creating, implementing, supervising, good RAP programming in an organization is to really kind of look at, how we parallel this process around, in RAP, we talk about a daily maintenance plan. And the first part of doing our daily maintenance plan is what we look like when we're well. And this is because it sets the stage for everything else, so that as we start embracing challenges and thinking about what tools we're going to use to those challenges in our individual recovery, we can come back to that kind of vision statement. This is what we want to look like when we're well. And so this is also how we know when we need to start activating our plans. Mary Ellen talks about oftentimes when we start to have early warning signs, we can go back to our daily maintenance plan, see that there's something on there we were supposed to be doing every day that maybe we've been neglecting. And so we can kind of come back to that. Organizationally, we need, when we talk about organizationally, how do we do RAP well, we need to know what it looks like when we're well so that we can provide the supports we need to facilitators to say, that we're on the right track or we may need support. So how do you do that? How do you know what it looks like when you're well, when you're doing RAP? I would say the heart of that is really going to be coming from knowing the values and ethics, which you learn most in the facilitators training. So just as a quick point, if one of the values and ethics is focusing on strengths and away from perceived deficits, if we have RAP programming or an agency where our focus is really on all the deficits of the people we're serving, of the agency itself, we're really not doing RAP well if we're really focusing in on deficits and not focusing on strengths and building on those strengths. Another example is that what has really made this work well for people is that it's always been a voluntary process. People have jumped in with both feet on a voluntary level. They want to do this work. And so if RAP is coming across as a part of a mandate or it feels like coercion at any level, then we're not doing well with the program. On a more extensive level, wanted to share here Judith Cook, again, her team there at the University of Chicago in Illinois, who really did the evidence-based studies with SAMHSA's support. They have also taken a look at self-advocacy, and you remember self-advocacy is one of the key concepts. So again, looking at how well we're doing with RAP, we look at and see, are those key concepts, are we seeing the outcomes in those key concepts throughout the culture of the organization? And they've developed a rather interesting scale here on self-advocacy. And you can see here that they call this the PSA, the propensity to engage in self-activism during healthcare encounters. And there's three components: education, assertiveness, and mindful non-adherence. So if you can go to the next slide, and you'll see that when they conducted a study and looked at people who've been utilizing RAP, the RAP participants reported higher levels of overall self-advocacy. And among those three subscales, the most significant was the mindful non-adherence. This was a behavior where the person who has utilized RAP would more actively, assertively disagree with their treatment options and their treatment professionals based on their own knowledge about what was working, not working. Now this could sound adversarial, but you can see in the previous slide really referenced this, but that people who were demonstrating mindful non-adherence actually got much better results in their relationship with their treatment providers. So also higher self-advocacy was associated with greater hopefulness, better quality of life, and less severe psychiatric symptoms. So this is an example of really looking at and supervising a RAP initiative to see that it was going well, because we can see the actual key concepts where everything evolved. We can see the results of that, not just in the person's developing the RAP, but within the system that was supporting it. Next slide. right, and BJ, if you could take it away.
Okay, so this part is what we live by, those of us who do this work, and I'm just going to, just for time's sake, I'm just going to read through some of this and give you a really short synopsis. And like Matthew said, when we get the values and ethics and RAP is really in the 5-day. The heart of RAP facilitation and the values ethics was people who share passionately about this in transforming process, like what came up when they were building the RAP plan for each other. And what happens in our trainings around the values and ethics that we hold when we're doing the trainings and that we implement in our life without the trainings. Next slide, Donna. Thank you. So some of where we live at with these values and ethics are just everything is based on self-determination. You know, it's up to us to move our lives forward. Now, I think that's everybody in life, not just people in any systems or any underserved populations or anything, that all of us are self-determined for something. Rooted in belief in equality. And one of the things that we stand for is everybody in the room is equal, whether we are facilitating or not, that we're not there to give them information of how they should use or do their life, but more so that we want to hear them so we can support wherever they're at. Promotes a mutual learning model. That means that I can get support from people as well as them getting support from me. I'm sharing stories as a facilitator or as a person doing this, just like I get to hear the stories of the people who are attending. And I think organizationally, that's what we're spreading when we're thinking of a mutual community when we're doing RAP organizationally, is that I could be the executive director, but doesn't mean that I'm going to tell the mail clerk that he has to listen to me or she has to listen to me, but that I value them as much because I wouldn't be able to do my job if they wasn't doing theirs. It's really learning that. To really avoid looking at people in this illness kind of way, but looking at people as in a wellness perspective and really having trust. And I think trust is the biggest thing ever, is always having that people are doing whatever they can do. So I wouldn't necessarily, I model that in the RAP groups by showing people that I don't necessarily have to use targeted language or clinical language to describe myself. I get to describe myself through the 5 key recovery concepts about how I educated myself about who I am. And that changes the language. It changed how I feel about myself. It changed the stigma in the world that I held, you know, about myself being whoever I was before. And I don't even have to describe myself in those factors. A volunteer, like we invite people into the process by through our own experiences, and we support not only our own personal responsibility, but that of others who clearly tell us what that is. The process of people working together, that there are always choices and options and not final answers. We're not there to give final answers about someone else because they're the expert on themselves. It's about also holding the 5 key recovery concepts and telling them in stories how that worked in my life. But really, what I'm showing in the RAP groups, how we get supported around that, is that my supervisor knows, the management knows who I'm being, what I'm doing in my life, and also are supporting me with that as well. Next slide, Donna. And these are just some questions that came up, and you know, these are some of the questions that we help people with in the 3-day of creating supervising RAP programs in your agencies. What are the changes that are hoped for in an organization or a county? And this is like, we talk to the organization or the county. I think that we couldn't give exact answers because every organization, community, and county is going to have different aspects. And we're just wanting to grow on the strength that they already have. What supports are needed and by whom? Again, it depends on what the organizational charts look like. You know, in the 3-day, we're taking each of the individual agencies who's showing up, the different organizations, and we're helping them to see what they can do, where they could build supports. We become a mutual supportive person in there with them. What is the role of supervision? It depends on how it's set up. Again, I want to say I don't want to give exact answers. I want to give people options and choices about this because this could be the supervision part can look different in a lot of organizations depending on how that organization is set up. And sometimes it may not be the direct supervisor. You know, it just depends. And I think the role of the supervisor is something that agency has to come up with as well. And how are wellness programs sustained? Again, when the whole agency becomes well, everything is sustained. Anything that they're doing. So yeah, so these questions are the questions that will be answered in the 3-day. Matthew, did you want to say anything on this slide?
I just thought, I thought one way of trying to really get to the heart of if as somebody who wanted to be an organizational leader, supervisor of RAP facilitation, you kind of must think about it as, I think most people are very familiar with something like yoga or Zumba, and I think the piece that people haven't realized maybe until now is that with RAP, because it is for anybody and everybody, because the perspective is for people and that we're peers and seeking wellness, that thinking about having a really healthy RAP programming would be like thinking about having a Zumba agency or a gym that offered yoga, and really saying that to do that well and to know what that looks like when it's well is to have the organization itself, the business leaders who also know and use yoga or Zumba. And that's kind of what we're saying about with RAP, is that I know it worked best for me organizationally and on a team with others that I had and used RAP myself, and that we could really talk about RAP together as people, both in their, being people's bosses, supervisor, but that we could talk about RAP as a common language to our jobs.
Next slide.
So, as we talked about earlier, the last and most sustainable point of which the Copeland Center has developed its training model is the advanced level facilitators training. Once a community has trained RAP facilitators and who have experienced facilitating the development of RAP for others, they may be able to become advanced level facilitators, which is a course that the Copeland Center has maintained so that we can kind of quality manage and quality improve the integrity and sustainability of RAP. Advanced level RAP facilitators become the RAP leaders within, with the Copeland Center, who are empowered to mentor others in the core values and ethics of RAP. So like BJ's relationship as an advanced level facilitator to the Copeland Center has to become a leader. And so in addition to having that training, also comes the years of experience utilizing that training in the community. One of the most valuable things when thinking about how we could do RAP, say, for this population or in this way, has always really been that we ourselves develop the Wellness Recovery Action Plan in that area of our life when we're engaging others to think about it in that area of their life. For example, as BJ highlighted and myself have utilized the Wellness Recovery Action Plan in many different aspects of our own life so that we could engage and introduce it to other people who may think about it in that way. As an example, I connect with and network with advanced health facilitators that utilize RAP for diabetes and smoke cessation. And so I coordinate with them because these are areas that I would not really be able to provide as engaging ideas around how I might use RAP for that because I do not have diabetes. And so really also always valuing that experiential knowledge, and that is critical. So with mental health employees who are advanced level RAP facilitators, we can partner in ways that are cost effective and yield long-term resources for offering RAP in our communities. But not only cost effective, but also allow us to be more and more accessible. We have advanced level facilitators now that are coming from the transition age youth perspective that are advanced level, very experienced in doing RAP groups who speak Spanish fluently And it's through this partnership that RAP becomes holistic, becomes accessible, and we don't have to create different silos for different aspects of people's lives. We are just peers and people who come together and we work collaboratively. Next slide. So using the key concepts of recovery to support and sustain RAP programs and facilitators. This is what we go through in the supporting, creating, and supervising RAP training. We talk about creating a plan for developing and implementing a RAP program. So, what would be the best plan for your organization? Identifying strategies to support and supervise the RAP facilitators, and enhancing an organization's peer culture through RAP. And again, as I hope you're picking up from this, when we talk about a peer culture, we're talking about in the way in which we work mutually and collaboratively with each other, not peer as defined by medical and clinical language. And so we would work through these key aspects, actually utilizing the plan and the concepts itself. But these are the kinds of outcomes you would expect to drive out of that. We can only really get those outcomes in a meaningful way by really working to customize it around your specific and individual and unique needs. Next slide. Taking the opportunity, one, make sure that you know about our website. You'll be seeing some significant changes at www.copelandcenter.com. We're undergoing a revamping our website, which will include the opportunity down the road for people who have completed the RAP Facilitators course to register as RAP Facilitators, as well as creating profiles and more information about advanced level facilitators. We do have a correspondence course, which many people have really found extremely helpful. This is where, and if people are not able to attend a Seminar 1 RAP group, they can take a correspondence course through the Copeland Center, where they can do this and through distance learning process. We also offer refreshers and retreats. The refreshers are an opportunity for facilitators to get the support they need, to come back to the values and ethics and practice our skills together, share our learning, and keep the collaborative ongoing process that we started 15 years ago continuing. Retreats are opportunities for people to come together to really to focus in and invest in their own wellness. These retreats have been attended by advanced facilitators and people who have never even used RAP before. Come out after 5 days in a usually very natural environment with new friends and new supports, new ideas for their own recovery. And in particular for this webinar, I'm excited to announce that our next international conference will be in Oakland, California, January 26th to 28th in 2013. Very excited. I hope I get to meet many of you in person at this conference, if not sooner. BJ, any final points, comments?
No, I think you've covered everything. Thank you, Matthew. And I just want to say, yeah, I hope to see a lot of people in RAP around the world.
So thank you, BJ and Matthew, so much for coming today and providing the webinar. I feel like we've only just touched on the surface of what's a bigger and really critical topic for how we continue to build organizational kinds of RAP programs, not just for the benefit of wellness in our organizations, but in order to support people in bringing strategies to other people and offering people information about how they can direct their own wellness. So thank you again. I've asked our audience if we have any final slides or if we have any final questions, and I got a question regarding the slides. Those will be sent to everybody who registered, so the email address that you used, you will be receiving a copy of the PowerPoint, and I will also be sharing with you a link probably in the next couple of days regarding how to access this webcast in case you want to review it or re-listen to it. So thank you again, everybody. My best to all, and as Matthew and BJ mentioned, we look forward to seeing you next January in Oakland if you're able to attend the RAP Around the World conference. So take care, everybody.
Thank you.
Thank you, Donna, Katie, and BJ.
Thanks.
and Tiffany.